Hi everyone. Today I'm going to talk about this very common problem in females, that is PMS, premenstrual syndrome. And today I'll be discussing about what are the symptoms that happen in PMS, whether it's normal, abnormal, why it happens, and when to consult your gynecologist. This PMS occurs in almost 75 to 80% of the females, and the symptoms which happen in PMS are dysmenorrhea, abdominal bloating, fatigue, it's low energy levels, diarrhea, constipation, nausea, vomiting, and the last thing is mood swings. Why this PMS happen? This female hormones, this estrogen and progesterone levels are not constantly or not always constant, and there will be fluctuations in these levels throughout the cycle. In the first half of the cycle, generally these levels will be estrogen levels will be high, whereas in the later half after ovulation the estrogen level starts falling, and because of this fall in the estrogen levels there will be drop in the serotonin levels as well. And this serotonin is a brain hormone which is a neurotransmitter, and it is responsible for the mood swings, this sleep disturbance, appetite. And whenever there is a fall in serotonin levels, you will experience this anxiety, depression, irritability, sleep disturbance, food cravings, which will happen in the PMS. And generally this PMS symptoms will start few days before the menstruation, and once you start menstruating these symptoms will automatically disappear. And in this period you can do simple walking, yoga, meditation, breathing exercises, and you have to sleep for properly 6 to 8 hours during the night times and take good diet to control all these things. And if you feel that your symptoms are very severe, it's not coming down and it is affecting your daily routine activities, then this is the time you have to consult your gynecologist. And coming to dysmenorrhea, dysmenorrhea is nothing but a painful periods, and you will have this abdominal cramps, lower backache, and the pain will be radiating to the thighs and even the legs, sometimes nausea, vomiting, headache. There are two categories: primary dysmenorrhea and secondary dysmenorrhea. And primary dysmenorrhea is due to the periods itself and there is no underlying causes, whereas secondary dysmenorrhea is due to the underlying causes like endometriosis, adenomyosis, fibroids, and sometimes infections, which we call pelvic inflammatory disorders. In primary dysmenorrhea, generally you will have pain 1 to 2 days before the menstruation, and it will last for 1 to 3 days during the menstruation. And this pain generally can be relieved by simple exercises, walking, this massages and hot fermentation in your lower abdominal part. And this is due to mainly the release of one hormone called prostaglandins, which will cause this uterine cramps, and that is the reason for your pain. And this happens almost in most of the females. Whereas in secondary dysmenorrhea, you will have the new pain which you are not experiencing previously, and the pain will be very severe, last long, and it might be associated with heavy bleeding, prolonged bleeding, sometimes foul smelling discharge, fever. So, in these cases, definitely you have to consult your gynecologist. Thank you.